Resurrection made me strong. Jesus, my Lord, is alive. Resurrection made me strong. Jesus, my Lord, is alive. While they were in the room, Jesus Christ himself appeared. My peace I give to you, and my peace with you I leave. My peace I give to you, and my peace with you I leave. Resurrection is my song. Resurrection gave me life. Resurrection made me strong. Jesus, my Lord, is alive. Resurrection made me strong. Jesus, my Lord, is alive. But Thomas did not believe what the disciples had seen. So Jesus again appeared, showed him the place of the spear. So Jesus again appeared, showed him the place of the spear. Resurrection is my song. Resurrection gave me life. Resurrection made me strong. Jesus, my Lord, is alive. Resurrection made me strong. Jesus, my Lord, is alive. The heavenly hosts were singing, welcoming our glorious Lord. And the joy is overwhelming. He opened the doors of hope, and the joy is overwhelming. He opened the doors of hope. Resurrection is my song. Resurrection gave me life. Resurrection made me strong. Jesus, my Lord, is alive. Resurrection made me strong. Jesus, my Lord, is alive. Alleluia, alleluia. Risen is the Lord of peace. Alleluia, alleluia. Truly he is risen indeed. Alleluia, alleluia. Truly he is risen indeed. Resurrection is my song. Resurrection gave me life. Resurrection made me strong. Jesus, my Lord, is alive. Resurrection made me strong. Jesus, my Lord, is alive. In the name of the Father, the Son, the Holy Spirit, one God, Amen. We're very happy and blessed to have with us a group of wonderful Christians from Wheaton College coming to talk to us about thriving together, about ADHD and beyond. So this is, I think, it's an important topic that we as servants and as leaders in the church should be aware of, learning together how to recognize it and be aware of all the issues and some of the ideas that we can help us into implementing that in our ministries. Rosie, can you introduce?
So thank you all for coming. We have some really great speakers here today. So you all know me, I'm Rosie. I am getting my doctorate in clinical psychology at Wheaton College. And these are two of my friends in the same program as me, and they've also been trained. They've had a lot of years of training and learning this material. So I'll give them, you all know me, so I won't introduce myself, but I'll give them an opportunity to explain a little bit about themselves.
Hi, everybody. Thank you for having me. My name's Christina. Like Rosie said, we've been in school together for 4 years now. I'm originally from Canada, and I'm moving back pretty soon, but I'm really happy to be here. I trained, sometimes our trainings are very different, but I've trained to do ADHD diagnosis in 1 year, trained to do therapy. I'm at the University of Chicago this year in the hospital, so a lot of different things, but ADHD is something that we learn about quite a bit. Thanks for having me.
Hello, a blessing and a pleasure to be here with all of you today. My name is Vernice Barramond. I'm from the Caribbean, so I'm from Trinidad and Tobago, but I was raised in New York City. Yep, we're all in the same cohort, so you guys know what school I go to and where I am in that, so I don't need to go there. But over the years in the program, I've been at like community mental health centers, private practice, and now currently another community mental health center. So I love doing that type of work. But yeah, as Christina was saying, ADHD it's a very prominent diagnosis, and we've done a lot of work with clients. Oh wow, that's a big difference. Okay. But yeah, so done a lot of work with clients with ADHD and whatnot, and blessed to speak to you guys about it today and discuss it. So yeah, thank you for having us.
And a huge shout out to both of them for coming. Both of them live in like the Wheaton area, so it's a little bit of a drive. So thank you both for coming. And Jawan, Vernice's boyfriend as well, which is very kind of him to come as well. So first what we want to do is we want to talk a little bit about why we're all here. So to start off, I want to ask some questions, and if this is something that you identify with, please raise your hand. So if you're a parent or a guardian, please raise your hand. Okay. Raise your hand if you work with kids as a teacher or as a tutor or in the church service. So you have any kind of interactions with kids. Mama too. Okay. Raise your hand now if you or someone you love has ADHD. Okay. Now let's raise our hand, or raise your hand if you've wondered, is this kind of behavior that I'm seeing in this kid, is it typical behavior, or is there something more? So if you've ever seen misbehavior and wondered what the reason for this misbehavior is. Raise your hand if you've ever Googled something about focus, behavior, or ADHD, and then ended up being more confused than when you started. Okay, and then lastly, raise your hand if you believe that every child is created in the image of God, even when they drive us a little bit crazy sometimes. Yes, okay. So we all have a lot of shared experiences, so it looks like we're all in the right room together, and we're gonna learn a lot today. So I'll start off with the agenda for today, some of our goals. So the main thing that we wanna do today is we don't wanna learn how to diagnose people with ADHD. We don't want people to walk out of here and point fingers at others and say you have ADHD and you have ADHD. But rather what we wanna do is we wanna learn more information about the things that are common in the people around us and ways that we can help each other. Whether you're a parent or whether you're a Sunday school servant, we want to give you some tools to be able to help people that struggle with these kinds of conditions. And the main thing is information. We all know that knowledge is power, and so since we've spent the last 4 years learning about this material, we really want to be able to share that with you all and help you all to learn more about what ADHD is and how we can help youth who have behavioral challenges. So we're gonna start off with talking about like what common behavioral challenges are, how to identify ADHD and some of the signs and symptoms, and then we're gonna give some practical recommendations and then some tips on when to take the next steps and reach out for support as well. And then most importantly, we want to talk about how we can learn to look at our children as created in God's image, even when they are misbehaving or driving us crazy. We want to be able to keep that in mind as we're going through all of this material. So the first thing that we're going to talk about are common behavioral challenges. So if you all have a handout, On the first page, there you'll see all this list of behavioral challenges. And a lot of them, might be things that you have seen in the youth. And if you have like a pen or something, you might want to like mark down like what are some things that I see a lot, or some things that like stand out to me in the youth or in my own kids, and kind of use that to guide us as we go through the rest of the discussion. But so what we can do is if we could go around and try to read these out loud, just so we can all hear it together. So if you have like loud voices, can we go around and read these behavioral challenges together? Can we do that? If you want to just shout out with a loud voice and read them in order. I can start. Insistence on sameness and inflexibility. Difficulty sustaining attention. Do you want to all go together, or are you trying to do that? Okay, can we keep, you want to read them? Let's read them all together, actually, okay? So, insistence on sameness and inflexibility. Difficulty sustaining attention. Does not seem to listen when spoken to directly. Does not follow through on instructions. Fails to finish tasks. Organization, forgetfulness. Excessive talking. Leaves seat when sitting is expected. Blurts out an answer when a question is completed. Difficulty waiting turn. Diminished interest to participate in activities. Low frustration tolerance. Aggressive behaviors. Difficulties falling asleep and staying asleep. Difficulty with transitions from one task to the next. Easily fatigued. Irritability. Skin picking, hair pulling, nail biting, and difficulty understanding what is being asked of them. Okay, so the reason why I wanted us all to read it together is because I want us all to understand that this is a shared experience, that it's not just my kid that might be experiencing this. And I want to open it up for discussion, and kind of see like what are some of the common behavioral challenges that you all might like see in your youth or like in your kids at home. You can keep that handout open to that page if you need any ideas, but I'm sure you might have them readily accessible, the things that you experience with your kids. So could we all maybe like give some thoughts or like share with each other like what are some behavioral challenges that we see in our kids? Yeah, we'll start with that. Yeah. Hyperactivity, yeah. 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 Cannot sit still. Yeah. Excessive talking. Yeah. Difficulty focusing, yeah. Okay, so what about another question? What I want to ask, I'm going to ask the one all the way in the bottom. What are you maybe hesitant with regards to like reaching out for support? When you notice behavioral challenges in your kids, what are some of the barriers that you notice that like that might make you feel hesitant to reach out and ask for support, George? Yes, that's really helpful. So you're saying that, so what George was saying is that like, he might feel like, who am I to kind of like identify or like say that this kid is having difficulties, so kind of just like, let it simmer. Yeah.
Maybe if I get my son diagnosis with ADHD, I'm labeling him among the student, and this is will, destroy his reputation or something.
I feel like that's something that we might often think of as like, you know, labeling each other or labeling our kids. Yeah.
Maybe the fear of being labeled as the bad parent for not being able to parent better.
Yeah, which is a concern I've seen like with a lot of people, like in clinical work and things like that, is like there's always a fear of like labeling the child, like Omega is saying, and then Sophie is also saying like, you know, labeling or having people identify me as the problem, like as the parent. I'm the one that did this. Yeah.
Maybe fear of kind of misdiagnosis, and the treatment brings other effect or cannot bring the good result. Maybe absolutely sometimes the doses could be different, could be challenged to determine exactly what is the amount, otherwise it will bring opposite results.
That's great. Thank you, Amo.
The culture background can cause some embarrassment to some parents. So I don't know how to avoid. Yeah.
So, Mama Tontoa was also saying that she says that the culture might expect that there's some embarrassment to talk about these things, or like to have a diagnosis as well. So, yeah.
Maybe because I think that my son is very active or my daughter is very active and there's nothing wrong with them, and it's like there is nothing, they are only active. So maybe because of my ignorance that I don't know that there is something named ADHD or something else, so that I don't believe in it.
So I think so. All these are really great things. I appreciate everybody for sharing. So let's jump into the next part, which Christina will pick up here.
Thank you again for having me. I think these are all excellent questions. And when it comes to, I think it was a really fair question that was posed of, right, if you're not the expert, how do you even know if this is a problem or not? Or is it embarrassing if you say maybe it's a problem and then it wasn't? I feel like I have these questions too. So when we think about what we understand behavior challenges, or as a future psychologist, what seems interesting or different or important to me? How do we determine that? Here are a couple of examples. So for example, the same outward behavior can have many causes. I think we can understand this. That's why diagnosing can be very difficult sometimes, because the same behavior, maybe someone doesn't want to go to school. Maybe it's because they're feeling more anxious. Maybe it's because they're worried about their schoolwork or about a bully, something like that. There can be many different causes. But how we understand behaviors, before we talked about how we are not alone in this, and that almost every one of the behaviors on that list maybe has happened to us once or sometimes happens to us, and we wouldn't call that really abnormal. But what we're interested in is whatever is happening is the intensity or the severity. So is it pretty mild, or is it something that's happening like very severely? And also how long it's happening, because let's say if we're talking about attention difficulties in a 4-year-old, that's pretty typical. That's actually, we can all understand that that's pretty normal 4-year-old behavior. But when it's worse than normal and for long a time, that's when we get kind of interested in it. So you can use that information that when you're thinking, is this normal or not, you can think about those two things. The other thing we think about is this behavior happening in every location, every setting, or just in some settings? That is another really valuable thing you can talk to, like a doctor or someone that you're going to help about. That would be really valuable information. So if a child is only acting out at home but not at school, that's pretty interesting to us. That gives us really important information. Or sometimes it's the opposite, only at school, not at home. Or sometimes if it's happening everywhere, that's a little more simple for us to understand. But these are really helpful things to think about when you're observing a child's behavior. The next thing is just thinking about why do children have behavioral challenges. We talked about the many sources before. So at the bottom is some diagnoses that we diagnose, but then at the top are some things that are pretty typical. Like I said, it can be very normal for a certain age child to have misbehavior or to have trouble concentrating. Sometimes it's stress that causes misbehavior. That's also very common. Or environmental factors such as the school environment, sometimes a style of a family dynamic, sometimes peer influences. So these are all the things that we try to understand while we're looking at a child who has some of the behaviors on the list and saying, what are we working with here? So today we're talking about behavior in general, but we're wanting to zoom in on ADHD because I think a lot of people talk about ADHD these days. People say, more kids than ever have ADHD, or how do we understand this? So I wanted to just give you some core facts that are really important and hopefully simple to understand, but I'm even still learning about this. So a couple of key ideas is that ADHD, attention deficit hyperactive disorder, is neurobiological. What that means is that it's a difference in your brain, maybe in how your brain is wired, maybe how the chemicals work in your brain, and that's a bit different than some other mental health diagnoses, where this is very genetically based. So there's even more of a component how this was inevitable. It wasn't something that the child did wrong or the parent did wrong. It's actually a brain difference. And compared to a lot of other diagnoses, it's fairly common. So almost 1 in 10 school-age children will have ADHD for no reason then. That's just kind of how their brain developed. Like I said, ADHD runs in families. If a child has ADHD, maybe a parent does or a sibling might too. Let's see, we talked about that. The idea that's also important to understand is that ADHD is typically lifelong. That doesn't mean that it's like a curse that will follow you the rest of your life. What we're trying to emphasize is that the earlier that somebody knows that they have it, maybe the earlier they can get help, or that they can maybe change the way they understand their behavior to help themselves. Because unless it's relatively mild, it's not something that you can just wait out. It's often something that might even get worse over time if it's not addressed or understood properly. But there are often cases where if a child has it and it's intense, but as an adult or in university, you understand yourself better, you get support, and then you can really succeed in school and do well. So it's not like something that could follow you forever, but it's just a different way of thinking. I'll just end here by saying the 3 main symptoms are inattentiveness, so maybe easily distracted, losing things, struggling to follow tasks, hyperactivity, fidgeting, tapping. Sometimes it's running around, but sometimes it's smaller, like hard to sit still. And impulsivity. So maybe that's like buying something, but it's often more like blurting out, interrupting, having trouble waiting your turn. And one key thing is that there are actually some subtypes of ADHD. So if someone isn't very hyperactive and only inattentive, that's okay. That could be considered ADHD. Or if someone is very hyperactive and not inattentive, that's also another subtype. The last thing I'll say is you might hear the word executive functioning if you Google ADHD. That's just how you organize, how you go about your world and your tasks. ADHD is trouble with motivation. So if you can't organize your tasks, if you can't stay on task, if you can't plan ahead, that's executive functioning problems, and that's a big deal for ADHD. Okay, just my last section here is about common misconceptions or myths about ADHD. And I think this is really important because at some time in my life, I probably held these assumptions as well, and it's interesting to kind of dismantle these a bit. So the first one is all kids with ADHD misbehave. And I think that I've just seen enough kids with ADHD that that's not true. So someone could be maybe really procrastinate a lot with their studies, but they still get it done because they're very smart, but it's very stressful at the end. Maybe they're at their school and they're very well behaved, but it's actually a challenge with self-control and focus, and it's not always that they're acting out. ADHD is just hyperactivity, running around, moving your body. That is like that for a lot of people, but some people that's not how it comes out. Kids with ADHD just need to try harder. This one is very common, and I think that because we really value motivation, we really value people trying hard at school, and when we don't see that, we often think, well, that's like a personality problem or just like something that they're not trying hard enough. When if someone has ADHD, because of the way their brain is, either they can't try harder, or they need a certain support or system that will help them rise to the occasion, because their abilities for trying harder, for motivation, is less than the typical person. And so that fits in with the last one, or the next one. They just need more discipline. This one also makes sense. Like, okay, I'll just, if a child can't focus, I'll just be more disciplined with them. And I think what we learn is that that can lead to feeling really sad about themselves or low self-esteem when you're trying hard, but you can't find your motivation. So what the research shows is that more structure and more support to help facilitate motivation or create protective barriers or just to work to their strengths is actually what's going to help them succeed. And sometimes getting intervention or getting support for people who specialize in this or seeking special resources is what's key, because it's not always intuitive what you can do to support someone with ADHD. The last few here, if they can focus on games, then they don't have ADHD. This one's also common. Just that whatever you, it's not a total attention deficit, but it's attention for things that are hard to pay attention to. If they're sitting in front of their favorite movie, then of course they're going to focus on that, but maybe a really hard school assignment, that would be more difficult. Smart children can't have ADHD. Often very smart children with ADHD, you can't tell that they have it until they start middle school or until they start high school, until the demands of school are greater than what they can overcome just by their smarts. And then that's sometimes when things fall apart, or when you realize that they need more help. The last one, ADHD is caused by sugar or screens. I think based on what we talked about before, that it's actually how your brain is different than other people's brains, that it's not the origin of ADHD, sugar or screens. But surely it's an interesting conversation to talk about how screens are probably making a lot of people's attention worse, or how screens probably could make ADHD worse. But it's definitely not the source of ADHD. My last slide here is maybe just what we talked about before, how there are a lot of things that could look like ADHD, but are something else. Or sometimes you think it's anxiety, but it's also ADHD. This is why our job is so interesting and so hard sometimes, is that, for example, someone with ADHD and anxiety might have difficulty sleeping, or have difficulty socially, or have tantrums, or have emotional dysregulation. But what makes them separate is that while ADHD is neurodevelopmental, like I said, anxiety is really excessive worry versus impulsivity, risk-taking. Anxiety might be avoidance of certain situations, whereas ADHD is more inattentive. So, we don't expect you to be able to really figure out what's going on and then go seek help, but we really like people that just come with questions, and that's really helpful for us. The last thing I just want to emphasize is that somebody like a child with ADHD, they're trying to understand themselves. Probably, maybe they get in trouble with their parents or their teachers sometime. And so what we want to emphasize is that it's really important to help understand a child and help them understand themselves, because it's actually very common that a child will have low self-esteem or will feel really bad about themselves when they are in this situation, because maybe they are always getting in trouble or they can't do what they really want to do in school. So a lot of support and encouragement and early support is really going to help them succeed. So, all right, I'm going to pass it off. Thank you.
So, now we're going to talk about some practical recommendations for general behavior management. So, the first one is showing genuine care and interest by listening actively. So, basically, just like listening to what the children are going through and validating their emotions. So, for example, if you're talking to a kiddo and they may be overwhelmed, they may be running around, something may be happening, like something really helpful is like actually like kneeling down instead of being like, hey, what's wrong? Or like, what's happening? You could be like, hey, what's going on? It makes a very big difference when you're talking to someone down versus eye to eye, right? So even something, a small little change like that could be very helpful in just being validating towards them, listening to them, and helping them feel very seen, which is very important as a human being, especially even if you're a kiddo, because they're just small adults, right? Just small humans. The next one is acknowledging and validating their feelings, which is, once again, very important, because especially if you're feeling negative emotions, you're angry, you're frustrated, you're upset, and then everyone's just kind of like going about the day and not realizing what's going on with you. Like, imagine how you would feel, right? If you're going through something and everyone's just like, la-di-da-di-da, and not really helping you in the way that you could be helped, right? And trying to figure out what's going on. No one wants to feel not seen. So especially if it's like anger or frustration, sadness, disappointment, just acknowledging that and being like, hey, I see you. What's going on, little one? And just letting them feel seen and loved, because they are seen and loved, but they may not be feeling that in that moment. The next one is promoting active engagement and physical movement. So we talked about like hyperactivity earlier. So sometimes, sometimes if a kiddo is very energetic, some of the kids, like even we saw some of the kids just kind of like running around because they are also just children, and sometimes they just have a lot of extra energy. They could have ate candy, whatever it may be. Sometimes they just have a lot of energy. So if you're working with kiddos, it's super helpful to kind of like have activities and things where they're like running in place, or they're like moving around, or oh, let's find a Bible nearby or something like that, to kind of get some of that energy out. So when it is time for them to just sit and having to listen to a Bible story or wherever it may be a bit easier, because some of that energy that they may be feeling is kind of out now. Like, we got to release it. So sometimes even letting them like run in place or do a push-up or let's do jumping jacks or whatever it may be can be super duper helpful. The next one is creating structure with routines and regular schedules. And this creates consistency, which is really helpful for children, and also helps children feel very safe. It reduces anxiety and supports better behavior by making expectations predictable. So every time we go to children's church or Sunday school, we always go in and we sit down first. We don't just go in and like, and like run all over the place. Every time we go in, we know they're going to tell us, okay, we're going to sit down, then we're going to do this, then we're going to do that. So having like a routine is very helpful, because when I go in, I know what's coming. It's not a unexpected thing every time, because then I'm just like, I don't know what I'm going into. I'm going to run in the secret seat and be like, and and not have a specific plan in mind. So just having that little schedule can be helpful as well. And giving simple, clear instructions. So instead of being like, okay, clean up time, like maybe like be a bit more specific. So if we were like drawing and coloring, say something like, all right, so we're going to put the crayons back in the box. We're going to put the papers in the folder, being a bit more specific and clear and still very simple. So a few more is positive reinforcement. So calling attention to and praising good behaviors and being specific. So simple things you could say is like, I love the way that you're sitting in your chair and you're listening so well. Like simple statements like that, just bringing attention to the good behavior, because let's be honest, if they're supposed to be sitting down quietly and they're running all over the place, you're going to bring attention to that behavior, right? You're going to say, aren't you supposed to be sitting down right now? We're reading. You're definitely going to bring attention to bad behavior. But if you actually bring attention to good behavior, it increases the chance of that good behavior happening more. And that's what we want to do. So when you see them doing something good, encourage that. Help them to be like, oh, I got told something good, like I'm doing good. And that's going to make them want to do good more. The next one is setting clear expectations for behavior. So this gives children a sense of structure once again, and reduces anxiety and helps them to know what is expected of them, that there are standards, there are rules that we have to follow. And simple example of this is, all right, now we're going to hear a Bible story. So what do we do during story time? We sit and we cross our legs and we close our mouths. And we put our listening ears on because now we're listening to a story. So simple little things like that can be super helpful. And once again, it gives the expectation. Every time we do this, this is how that goes. So it's simple. They remember, you remember, we're all on the same page. The next one is setting clear limits. And this teaches boundaries and helps children feel safe with consistent guidelines. So for example, whenever we use scissors, we don't poke people or they will get taken away. Helping them understand like we can't just do anything and there are rules and boundaries to what we can and cannot do. So there's that. And lastly, consistently enforcing rules and consequences. So this helps build trust and accountability, showing children that actions have predictable consequences. So if a child has a 5-minute break today because they were very emotionally overwhelmed or something may be happening, then tomorrow, if the same thing happened, or next week, or whenever it may be, then it would be the same consequence. So we can't be inconsistent. It can't be like today, someone got in trouble, so hey, you can't play for 3 minutes. And then next week it's like you did the same thing, but it's like, okay, you can't play 7 minutes. And the next time it happens, it's like, okay, you can't play 1 minute, but then you could come back. It's very inconsistent. The child is like, okay, like depending on how the person feels is going to be different. So it's a lack of consistency, which then kind of makes it a bit more variable in terms of their behavior and what the punishment is. There's no consistency. So try to be as consistent as possible. Alrighty, so a very important thing is for us, for you yourselves, to remain calm, because children can get emotionally dysregulated very quickly. I'm sure you all have seen this at some point or experienced it yourself as a kiddo. And sometimes it's just hard to regulate and manage your emotions. So if a kid like throws something or they just get up and start running or whatever a kiddo may do because they're a kiddo, something you could do is like maybe just take a deep breath before responding, because for a variety of factors, you may respond in a bunch of different ways. You may yell, you may be like, hey, what are you doing? Or like, you could respond in a bunch of ways depending on where your mindset may be in a moment. But trying to just take a deep breath and be like, okay, what mindset am I in before I even engage with this kiddo? I think is a great step. Because if you're already stressed out and like a bit maybe scatterbrained or whatever, or stressed in whatever the case may be, and then a kiddo is also going through something, it's going to be hard for you to help them regulate their emotions because your emotions are not regulated either. So you guys are just sitting there as two unregulated people, and that's probably not going to get you to the calm place that you're trying to get to. So there's that. The next one is, okay, we kind of said this one before. So just getting down to their level, talking to them like on an eye-to-eye basis, helps them feel seen and respected, and they're more likely to listen and engage if you're like down on their level as well. Redirecting their attention to something more appropriate specifically. So if we're all sitting here, story time, the Bible, the story about when Jesus was performing a miracle or whatever it may be, then someone just kind of gets up and starts to wander off, helping them to like redirect their attention back to story time in some way, shape, or form, just bringing them back to what they should be doing in that moment. And also, once again, going back to positive reinforcement. So when you do redirect them to come back and sit down, be like, I love the way that you are sitting. Now, thank you for rejoining the group, to reinforce that good behavior. So they keep doing that. And you want them to engage with the rest of the groups. You don't want them on their own, isolated, running around. You want them to engage with their peers too. Also, if a child is yelling, lower your volume rather than yelling over them. Once again, this kind of goes back to that regulation, because if, once again, if both of you are unregulated, it's going to be very difficult to get the child back to baseline if we're both not at baseline. So if they're like, oh my gosh, I want to go home, I don't want to be here, and you're just like, well, I don't know what to both of y'all just are looking every type of way that you should not be looking. So if they're like, I don't want to go home, you could be like, Jesse, I see that there's a lot going on, my friend. What's going on? But you see how if I respond like that versus now we're both just yelling. I'm yelling with a 7-year-old. How do I look? What's going on? Like, what is happening? They're still dysregulated. I'm now dysregulated. We're not getting anywhere good, right? So it's very important for us to be able to manage our emotions so that we can help the kiddos do the same. So, and this is a part of like role of modeling as well and showing them how to regulate your emotions and how to communicate your needs. So you're teaching them a lot by just remaining calm yourself. Alrighty, and the last one here is changing the setting. So if in this setting a kiddo is overwhelmed, something's happening, a very simple solution could potentially be to just remove yourself or the kiddo from the, not yourself, remove the kiddo from the setting. For example, if something happened, one of them threw something at the other one or whatever the case may be, so now they're upset, you threw a doll at my head, or whatever it may be. You'd be like, okay, I see you two, there's a situation here. Hey, Jackie, I see you're really upset right now. Do you want to go like on the reading mat and just kind of like hang out and like calm down and walk around with me for a little bit? Yeah? All right, come. So me and Jackie go walk. And hopefully there would be another teacher as well to kind of be with the other kiddo and help them just get calm and make sure everything is okay with them, make sure they feel seen and heard, understand the situation, and help them to just be okay and feel loved. Okay, so offer reasonable choices. This is one of my favorite ones. I'm not gonna lie, because you guys know how God gives us free will. That's one of my favorite things, because God, I love the fact that God doesn't want robots. He wants people who want to seek Him and follow Him and love Him, right? Which is so amazing, because He really could have just made us robots if you think about it, but He didn't. So I love the idea of free will and choice. And if you think about choice, what choice gives you? It gives you a sense of autonomy. It's like, I'm a person, I have power, I have a will, I'm exerting my own power in this moment. So simple things like, Jade, you can color or you can play with blocks. It's your choice. What do you want to do? It doesn't seem like a big deal, but a kiddo being able to choose, especially when, if you remember being children, you get told what to do a lot, don't you? Most of the time it's like, hey, go do this, go do that. So like someone actually telling you like, hey, you have an option, like you get to pick what you get to do for the next 15 minutes or whatever it may be, is so empowering that it's like, oh my gosh, I'm making a choice. So that's a really good thing to do with children, or anyone in general, honestly. But the next one is talking to them about what they're feeling and experiencing. So literally, kind of what we've been saying this whole time, just validating their emotions, helping them to feel seen, heard, and loved. The next one is talk to them about the impacts of their behavior on others and what they can do to make amends. So this one is leaning more into like empathy, because we also have to help teach children that actions do indeed have consequences, and consequences can be good, but consequences can also be bad. So if I take a rock and throw it at Tommy's head, there's a response to that. Like, Tommy's gonna feel hurt. Tommy's over there crying, and it's just like, oh well, I did that, so I should probably be accountable for that and say that. And it helps to teach them accountability as well as empathy. Like, oh, I hurt someone. Like, whoa, how does that impact me if someone else is hurt? Should it impact me? Does it impact me if I hit Tommy with a rock? Should I be bothered or moved by that? And this kind of helps teach all of that. And yes, it does. The answer is yes. So there's this little case example in here. And it says, during craft time, 7-year-old Daniel gets upset that his glue stick is missing and pushes another child who is using a similar one. The other child starts crying, and Daniel crosses his arms and refuses to talk. So in a situation like this, with all that we've just talked about or read about the past 10 minutes, what would you do?
and start talk to him one by one,
Yes.
gently.
I think that's the perfect start. It's like, all right, Tommy, what's going on? Getting on his level. I think perfect start. Is there anything else we're going to do? Are we just going to sit next to Tommy on his level after he just did all this? Yes, 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 yes. So if you didn't hear her, she's basically saying listening to him, validating his emotions, and also like honestly giving him other options of how he could have dealt with his emotions in that moment. But I think the validating is the best part. It's just like, okay, like I see I understand what you're going through, but also letting him know that, oh, there was another way I could have dealt with this, right? I didn't have to go that way to do that. So yeah, I think that's great. And any other thoughts? All right. If no other thoughts, then something else we can do in addition to these two things, I think, is to kind of acknowledge how what Tommy did has impacted this other kiddo, right? Like, okay, you like pushed another kiddo and now they're over there crying, so you hurt their feelings, like you hurt them. And that's a concept that they need to understand. Like, if I do certain things, it can make people feel great, or it can make people feel nothing, and they can be oblivious, or they can be negatively impacted by what I do. So the things that I do does make a difference in the world. It's not as if I throw something at your head and you're just like, okay, and keep walking. Like, you're negatively impacted by that. So helping them to understand that, and also asking them, how would you feel if someone did that to you? Most kids would be like, well, I wouldn't like that. Like, I would be crying too. And then that kind of helps them make the connection too with empathy, and like, oh yeah, I probably wouldn't want someone to do that to me, so I probably shouldn't do that to other people. So that kind of helps make that connection too. And also just asking them toward the end of the conversation of, what can we do to make this better? Since, okay, you did something and it hurt someone, now you're probably not feeling the best about that, they're not feeling the best about that. What can we do? And they'll probably say sorry. Yeah, I think that's a good place to start. Or something like that, or most likely go like that. So there is that. And thank you all for participating in that too. And now we're in a bit of a different section. So this is when and how to take next steps. So when you're noticing different behavioral concerns, of course, consider notifying the child's parents, or Father Samuel. When observing a consistent pattern of mental health related systems, so maybe if they're like always sad, or they're struggling to concentrate or focus, they may have extreme mood swings, like they may come in like jolly and prance, and then like maybe like 30 minutes later they're like in a completely different mood, things like that. Emotional distress, so all of a sudden like they're normally with all the kiddos, but then like for the past 3 weeks they're like always off to the side by themselves, just like, okay, like what's going on there? That's definitely something noticeable. They may feel a lot of guilt and shame, which will kind of lead into that withdrawal thing. There's other signs of distress, so hypervigilant, like they get like scared by like loud noises very easily. Like it may just be like a little boop, and they're just like, whoo. So very aware of the surroundings, to a pretty extreme extent. They may fear certain people, so you may see someone you see all the time, and they're just like, oh nope, and like they're like kind of moving back or going toward their parents and acting very scared. Those types of things. Regression is when a child begins to act as a younger age than they currently are. So they may exhibit things that they were exhibiting when they were like 3 and they're currently 7. That's a sign as well. They may display severe tiredness or sleep-related symptoms. They may be struggling to sleep at home. They may be struggling to go to sleep, stay asleep. Either one, it's still something to notice. Being very disrupted in the learning environment, so this leans kind of more into concentration and focus. They may just be struggling to focus at school or at children's church when we're like reading a story or something. It's very hard for them to just keep their focus on the person reading at the time. And aggression towards peers or adults, bullying or escalating conflicts or causing problems, bullying behaviors, different things like that. And I think it's very important here, this is kind of where we made this note, to say that it's important to refrain from diagnosing, as this lovely gentleman said earlier, because we don't want to say, like, hey, I think this kid has ADHD. I don't know what's going on here, but the behavior just kind of out of whack. I don't know. But what you could say instead, when you're bringing what you're noticing to Father Samuel or to the servants or to the parents or whoever it may be, it's just like, hey, like I've been noticing, like kiddo has just been struggling to stay in their seat recently. I don't know what's going on. I don't know what's happening, but that's just what I've been noticing. I don't know if you've noticed it at home or in any other context, but that's just what I've been noticing. So I just wanted to bring it to your attention. So we don't have to diagnose or put any type of label at all, but we can just state the behaviors that we're noticing and seeing. In terms of safety concerns, basically we should involve parents and or a mental health professional if a child discloses any type of abuse, physical, emotional, any type of abuse at all, of course. If they express details of neglect or like unsafe living conditions, if they display like bruises or marks on their arms that are like not explained by, oh, they were playing, or oh, we went on a trip, or if there's like unexplained bruises and whatnot, that's a cause for concern. If they themselves just mention self-harm or suicidal ideations, things like that. So yeah, and for stuff like suicidality, that may most likely be more immediate attention. So that might be like a potential emergency call and stuff like that, depending on the situation. So there is that. And in terms of spiritual questions, so referring to the child's parents or Father Samuel when a child expresses theological confusion or spiritual doubts that are unnecessarily advanced. So kind of asking for more spiritual help in those moments and reaching out for that. Or like a persistent fear of God or hell or spiritual life that impacts them on a daily basis, to the fact that it's impacting their actual functioning. Definitely a cause for concern. So I would definitely talk to Father Samuel about that for sure. And after all of this, I think it's just important to remember that you are not alone in anything that you're dealing with, especially in this. So this is a good time to just remember that there's so many resources, there's so many people who love and care about you, and not just you, but the family and the kiddos as well. So even though some of this stuff may be hard to deal with at times, and like Rosie was saying, kind of very frustrating at times and confusing, like, I don't know what's going on, oh my gosh, like I'm just trying to be the best parent possible, but I don't know, I literally don't know what's going on. Like, there are people, there's Father Samuel, there's the mental health professionals, there's so many other people who love and care for you and want to help. So just remembering that, regardless of some of the negative things that could potentially be, I would say that it most likely the benefits would greatly outweigh the positives. So that's all I had to say about that. Thank you.
So just to wrap up, it's not on the slides anymore. But one thing I just wanted to talk about was just the way that Christ approached people who had differences and who had different people who did sin, but like in the time of Christ, the way that he approached them was with the perspective of love and with an open heart to accept them and to minister to them. And so that's something that I've really learned a lot at being at Wheaton, is that that it's so important to have that perspective of Christ. Like, how would Christ view this child right now if he were in this situation? So I think it's just really important to go back to that, especially and most importantly during those times of like misbehavior. So we'll wrap up there, and we would love if anybody has any questions that we can, any of us, if you have any direction or questions for any of us, or yeah, we would love to answer those.
So the practical ways you just mentioned for misbehaving, it will be the same with younger as more grown up, or it will be different?
Like teenagers or adults?
Middle school, high school.
Yeah, do you want to speak to that a little bit, or do you want?
I would say, yeah. Okay, well, there are some things that are more for kiddos, like getting for a teen. You're probably, well, for some of them, you might be looking up because they're so tall these days. But but generally speaking, besides the things that are more specific, like height and things like that, yeah, generally speaking, I think the ideas are still the same for the most part. I think the way we created this was more for younger kiddos, but I think a lot of it could be adapted to teens and things like that. Like the context of what you're saying may be different. Like you trying to show a 7-year-old how him throwing a rock at someone is negatively impacting him. You might not have to do that for a teen. Like they know that they should not be throwing rocks at that point, most likely. So certain things may be a bit different in the context, and it may be a bit deeper, but the general like idea is generally still the same.
And I can also add, like, Vernice was talking a little bit earlier about offering like choices and options. Like that's so important, especially with like the middle school youth. Like when they are misbehaving, it's not like sit down and stop talking. It's like, I think it's an important time to, like, again, what she's saying, validate their emotions and understand what they're feeling and why they're feeling what they're feeling, because that's the core of it. Is like there's a reason why a child is misbehaving, and we have to, like, we as the parents have to like empower them to be able to, or parents or servants, whoever, we need to be able to empower them to articulate, to like put words to what they're feeling. So if they're feeling like angry in that moment, or they're feeling like other kids are getting attention and they're not, they have to be able to like speak that. And so we as adults, like we need to help them get to that point, because that will help them increase their self-esteem and their confidence and their ability to interact with people in the world and in the future. Yeah.
What are the most common causes of ADHD? Are there causes for it, or it's genetics, or what is it?
I think it's they do have a lot of understanding of ADHD, and there's still parts that are unknown, like many even physical conditions. You ask, like, yeah, why did this happen? And there are similar responses to this is just a genetic way that a brain develops, and in the same way that people have a lot of questions about how autism develops, for example. Not that they're very similar. It's hard to point to something to blame. There are things that can make it worse or can make it better. But I think that very often we see that this is just something that runs in some families. Would you guys add anything?
Okay, I have a question. So how the screen time affect the kids' behavior, like TV, games, social media, and what are the alternatives for the screen time?
Yeah, what a great question. I feel like this is where ADHD and attention problems, it gets more confusing, because I think I am of the opinion that screens don't help attention. The screens make attention worse. So maybe people come to us and say, is my child just addicted to the screens, or do they have ADHD? It's like a very common question. But I would say that, like, just in general, this isn't even a psychology topic, but the way that social media, that websites are created they're specifically designed to capture your attention in a way that's, all of the best computer scientists, that they created it to be so alluring, so interesting. And I think that's what makes people with ADHD specifically vulnerable to becoming really into screens, but also any other young person who their brain is still developing. So I think that that's what the danger would be. An alternative, I think, research also shows that for young people, they're just getting out and hanging out with friends less, because more of their life is on the screens, is on computers. There are many ways that it connects us better, but I think that offering options that connect you more with your peers is always a good idea to replace screen time. I'm thinking maybe with teenagers more, but with children, something that's not so designed to capture your mind. Something,
Specifically for like younger children, I know something that I've come across recently is like the types of shows that you allow them to watch, because some shows, like a lot of shows actually for children, they have a lot of like frames per second, so it's like every second, like honestly in less than a second, you're seeing so many different things at every given moment. There's a lot of colors, it's like a lot going on. It's just like you're like, when you're looking at stuff like that, there's this there's this chemical in your brain called dopamine, and it's like going off, and dopamine is related to like what you feel when you're getting rewarded. So it feels very good when dopamine is in your brain. So imagine being a kiddo and you're watching like, I don't know, Power Rangers, something. I don't know what the kids are watching these days, but you're watching something with a lot going on, and like the dopamine just in your brain, like, oh my gosh, oh my gosh, oh my gosh, and you're getting a lot of that. So there are certain shows that are a lot more calm, a lot more like there's not as much going on, it's not as many frames per moment, the characters are even moving a lot slower. That is something that I've seen a lot of parents say, this has helped my child so much. They were like, when they were watching other things, they were just like, let me not name nothing, but certain things, it seems like it's just a lot for children, and then it's a lot for them and for their bodies and for their brains and for their nervous system. And then more calming shows that are a bit slower just seem to be a bit more beneficial. So I'd say that. And maybe just like even as adults or older people, like limiting screen time. Like I know we have the settings in our phones where we can limit that stuff and whatnot. And just like Christina was saying, going outside, hanging out with people, like just doing different things, and or if it is if there is a symptom of more of like hyperactivity, finding ways to get that out. So working out, going to the gym, doing something fun, which is also good for your health in general too. So yeah, different things.
Thank you.
Thank you all for a wonderful presentation and the very rich information and the guidance. But my question is, if I'm a parent and I have my son or my daughter, based on your behavioral management, I can't do that at home. But I'm still getting, request from school, parent meeting, schools, Sunday school sometimes servant complain. So I'm hearing from here and there about my son or my daughter. What will be the next step? Do I have to go to doctor, or I have to go to psychiatrist, or I have to go to psychologist? What would be the next step? Because it's beyond my limit.
Thank you for your question, because that's what you guys are here for, to know what is the next step. And I think it's important to realize where your limits are, and that there are people that are really happy to help out there. So I think it depends, if we're talking about ADHD specifically, in that scenario, you already have a lot of information. What does the teacher think? What am I noticing? There are different steps for different systems. Sometimes you can find a psychologist who does testing. So that's what we were trained to do, assessment. And you can go to them, and they want to really know a lot about your child, and they can give a really thorough testing to see and recommend very specific recommendations. Or sometimes if you trust a doctor, you can go to them, and if they refer you to get a neuropsychological test, sometimes that's a requirement. But from there, people take different paths. Let's say a physician can diagnose ADHD, or a psychiatrist or a psychologist, although psychologists are most qualified to, or most practiced. And from there, some people choose to try medication with their children. Some people don't. Some people choose to tell that to a school so that your child can get accommodations, which is often what we recommend the most. Because if a child if we can give specific recommendations to the school so that they, or, to help you understand, so that they can be supported in a way that's very specific to ADHD, which requires accountability, requires checking in, maybe giving a little more time on a test, because that's very common, having trouble finishing tests on time. That's another thing people do. Sometimes people seek therapy. With a child with ADHD, that's not as common. But when you're feeling at your limits, I think starting to seek out further expert understanding of your child is what I would recommend. Like, further understanding so that you can understand them, so that the child can, and then to see what's next in terms of interventions. What would you add to that, Rosie?
Yeah, I would say like after you get like a pretty solid understanding of what's going on with the child, like, or youth, and you can get like a solid diagnosis, then you can decide, like she said, like if you want to do medication for therapy, or if you want to do like have them meet with a therapist who can help them like practice, like, okay, we're gonna set like schedules together or goals and meet them together. That can be like a really great opportunity for them to learn some of the behaviors that you want them to learn, is if they're meeting with somebody on a consistent basis who's like trained in like teaching them these things. So that would be like another step to take. I think, like Christina was saying, like the very first step is to solidify the diagnosis, because if it's ADHD, there's one route you take, and then what if it's actually like anxiety? Then that might be something totally different, and it might require a completely different intervention. So it's important to figure out like what is it that's going on with them, and you start by going to, you can ask like your primary care physician if they can refer you to like a psychologist or a neuropsychologist, and a neuropsychologist or a psychologist, a clinical psychologist, can only do that full assessment to get an accurate diagnosis. Yeah. Yeah. Like, how should you approach it? Like, how should you approach quieting the kids down for the lesson? Okay. So yeah, so if you've tried multiple times and they're not listening, I think it would be a good opportunity. Like, hopefully there's multiple servants in the room, and you can have one servant, like maybe step out with them. I don't think it would be helpful to just kick them out of class, but maybe one servant goes with them and helps them to regulate. So it's not like you're taking the kid out to go yell at them, but it's like, we're gonna go out here and let's help you regulate yourself. Okay, like, what's going on? Why, like, tell me what you're feeling. Like, did something happen this morning? Is everything okay? Check in with the child, or if it's in middle school, even, like, it's helpful to kind of just help them identify what they're feeling and why they're choosing to act out based on those feelings. And then once you can talk that through with them, then you can hopefully bring them back into the room and start the lesson, or have them join the rest of the class. But that's why it's always helpful to have multiple servants in the room, and I know that most of our classes do, so that would be good.
I was just thinking about the questions that Rosie asked at the beginning, and about the really good thoughts that you guys had about what maybe makes you hesitant about diagnosis, because I think that diagnosis can feel like mysterious or uncertain or labeling, or how does that reflect on you as a parent? And I think it's like very honest to think about those things. But I think from our side of what we see is just the cost and the challenge that a lot of people face when there are things that are difficult for them that they can't explain or they don't understand. And yes, like, very good questions about right, being labeled or sticking out at school, or if someone thinks they have ADHD, will they say, well, I don't have to try because I have ADHD, or will people think like, oh, that parent must be doing something wrong because their kid has ADHD? And those are all difficult questions, and seeking support is also somewhat unknown. But I think that we've all seen the positive impact of when a child says, wow, I am not lazy, or I'm not a bad kid. Like, I think there are ways where children feel like they can't do anything right. And when you can tell them, this is not your fault, we're going to help you. Because it's hard to figure out as a child, hard to figure out as a parent, but there are experts that really want to help and really have dedicated their whole life to special solutions. So yeah, I think I just wanted to say more about that because I can see the cost to a lot of parts of life, not just school, but, you know, like I said before, self-esteem or even relationships. ADHD is common, but yet it can affect someone very deeply. So getting help early is really important. Yeah, that's what I had to say about that. Maybe there are other questions.
Yeah, we probably have time for maybe one more question or two. Yeah, yeah, and that's a big fear for a lot of people. If I can. For medication, as the, you know, the best type of treatment is honestly it's medication and therapy at the same time, because then you know, with medication you're biologically and chemically, like biochemically controlling what's impacting their behaviors. But then therapy, what that's going to do is that's going to teach them the practical skills, like when they're at equilibrium, what skills can they learn so that it can continue and they can like really implement that into their lifestyle later on in life, and or even now. So I think that you know, a lot of people end up staying on medication for a very long time, but it's not required and it's not really advantageous, really, because you want them to learn how to have these skills, and you can't really expect them to learn if they're not being taught. So if a parent like is really like consistent in teaching them the skills at home, that would be helpful. But I think my recommendation would be therapy and medication at the same time, so that you can wean off of the medication eventually. Well, usually you don't really need a referral for a therapist. Like you can go to a therapist and say like, "Hey, my child has ADHD. Can they meet with you?" Or yeah, we handed out a sheet that has some referral resources, but like I think the main thing is looking for somebody who specializes in child and adolescence and somebody who also works with people who have ADHD. If the person is trained in working with child and adolescents, they most probably deal with a lot of ADHD. So, but that would just be the main thing. So just calling places, see like who matches, or like who your insurance takes, and they have the
Yeah, I always give this advice because I know like trying to find services through insurance can be so difficult. So I always tell people to just like, there's normally like a phone number for your insurance that you can call and just say, hey, okay, like, can you give me a list of all the people near me in like 10 miles, 5 miles, X amount of miles that accept this insurance, who are accepting new patients? Because you don't want to call people and they're like, we're not taking anyone new. I don't want any of you guys to waste your time. Time is very precious. So call them and ask them for those things. And normally they can just like email you a list of all those available people who take your insurance for sure. So.
Was there one more question that I saw? A hand raised? No? Okay. Oh, yeah, she's asking if the parents are the cause. If, saying if it's caused by genetic factors, or like if the parents do it, or if the parents are the cause. Okay. So age group and like the age that's typically noticed, and if the parents are like, if it's genetic, and also cause the role that the parents play in the development of ADHD. Can somebody translate? Can we answer and somebody translate?
Or should we discuss and then you answer?
Or summary?
Should we discuss it and then you answer in Arabic?
My Arabic is not gonna be fine.
Really?
Huh?
We thought you were a genius at Arabic. Sorry, what was the questions? What was the
She
first
asked
one?
like 5 questions. One, if there's the first question she asked was if like she said it only like does the mother have a role in the development? So yeah, she's asking if the mom has a role.
She's asking about if we have a role in raising a kids that come with ADHD. She's not asking about genetics.
She's asking, yeah.
So if it's like when you are raising a kid, is there something I'm doing wrong that raise a kid with ADHD?
Yeah. Right. Yeah. Yeah.
I feel like it's
Is it my
like,
fault? Yeah.
I feel like it's really if that like if you notice something but then you don't seek extra help, then it could get worse. But
Right.
And then Rosie, and the other one of the age.
Right.
She's asking about the factors we are seeing. How many factors of these you are asking to say who has ADHD? Like how many of these you can say, oh, how many factors of these that you have the challenges? We can say, oh, if we have 5 or we have 6, this is when we kind of diagnosing him with ADHD.
That's why you go to a psychologist. Yeah. And I think she's asking the age.
No, not age. So she's asking about
The
these
number of
challenges. How
these.
many of these we can see as a 5 or 6? Oh, now I see. Oh, this is my son has.
Yeah. I would just go get tested. Yeah. What were you gonna say? Is it my fault?
Can I say something about this?
Yeah.
So usually when they go to school, the teacher will notice something, and then in each school there is a psychologist. So usually the teacher will talk to the psychologist and the principal, and then they will have a meeting and they will discuss what the kind of sign they see on the kid, and then they will call the parents and they will notify them. We see this and this. How about, and they give them kind of some suggestions. This is usually kind of what happened and how if the parents not aware of what's going on.
Yeah. I feel like with that scenario here.
I think what we are trying to emphasize very strongly is that the full ADHD diagnosis is not caused by a parent. And I think that when a teacher is talking to a psychologist at the school, I think they're not trying to say, like, what's wrong with the parent? Why is this student acting out? They're actually saying, maybe this is harming their learning. Maybe this is. Yeah, and so I think that's an important thing to think about is that ADHD can harm learning, and that's why when something is offered for help, even though it can seem uncertain, it most likely can really help your child to succeed in school and with their friends and to have to be healthy. And then a very good question about how many things does it take to have ADHD? And that's, yeah. And it's hard because that's what we go to school for 4 years to understand. So if you're thinking, well, what if there's only one or only two or only three? You can still take your child to a psychologist, even if you don't know how many there are. But if a teacher is telling you this is not typical, hopefully they're not saying, what's wrong, what did you do? But they're saying, maybe there's something different about your child. Maybe they just need more help, because a teacher sees so many students and they can kind of see what's a bit different.
So just add.
Again, thank you so much for coming and a wonderful presentation. God bless you all. Okay, let's stand up to pray. In the name of the Father, the Son, the Holy Spirit, one God, amen. Heavenly Father, we thank for your blessings. We thank for your love. We thank you for creating us in your image and likeness. Heavenly Father, teach us, O Lord, how to love you and love one another, we know that your Holy Spirit guide us and give us the wisdom and how to deal with every child that you entrusted us to minister to. Bless all the ministries of the church. Hear us when we pray thankfully, our Father who art in heaven. Now, Lord God, the Father, the grace of his only begotten Son, our Lord God and Savior Jesus Christ, gift and communion of the Holy Spirit be with you all. Go in peace. May the peace of the Lord be with you.